Well, good afternoon, council members. My name is Jason Balling, and we're here to provide our bi-weekly COVID update and then answer any questions you may have. We're going to go through a couple key highlights and new points of information that we wanted to share with council, and also this is being recorded, so we'll make sure that the video recording gets out to council members as well. So thank you, Sarah, for launching the presentation. Joining me today are Deb Fetterspiel, our Deputy Director, Sarah Mock, she's our Director of Data Planning and Communications, and I believe Lane Lanzer's on the call as well, and she's our Director of Community Nursing and Epidemiology. So if we go to the next slide. What we're seeing happening, and this is happening pretty much in the Denver metro region, is we're seeing an increase in cases. So you can see specifically in Broomfield, we've had 48 additional people that tested positive for COVID. We've had 4 additional hospitalizations, thankfully no additional deaths. And our percent positivity is trending upward, as is what is happening in the state. Next slide. So you can see as far as our 14-day moving average hospitalizations, even with those additional hospitalizations, we're significantly below the snapback measure, which we would potentially use for tightening restrictions. So at this place, we continue to not see the level of severity in Broomfield County. Next slide. So what are we seeing statewide? Hospitalizations are increasing slightly. Deaths do remain on the decline, which is good news, but we know that's always a lagging indicator. We are seeing across the country, and we've been saying this here in Colorado, a rapid increase in the Delta variant. We do know that the vaccines remain very effective and are the most effective at preventing hospitalizations and deaths, even with the Delta variant. The pandemic has, as it's being described nationally now, is really happening within our unvaccinated population. So we're seeing this across the state, and we've mentioned it over our past few updates that in counties with lower vaccination rates, we're seeing significantly increased cases. Thankfully, again, we're not there in Broomfield County. Nationally, what we are also seeing is among vaccine individuals, breakthrough cases occur in less than 1 in 10,000. And that's important to mention because we know the vaccines are extremely effective, which we'll talk about later, but there is always the potential for breakthrough cases. One thing we're looking at is as the Delta variant spreads, it's more likely we'll see increased cases in Broomfield among our unvaccinated population, especially as it becomes, or as it spreads more within the Denver metro region. And we're seeing more mobility and just relaxing of a lot of the mitigation measures we had in place before, which increases that potential for risk. And we're more likely to see some breakthrough cases in Broomfield as well. It's likely that not all of our cases are being detected, both in Broomfield, Colorado, and nationally. This is potentially due to the lack of testing. So again, some people that are asymptomatic or they get the mild illness may not be going out and seeking that testing. And others may not be getting tested because they're vaccinated. We still are recommending if you're vaccinated and have symptoms, COVID symptoms, that you do get tested. So next slide. So this slide just shows what I was alluding to before, that we're seeing in the real world, or this playing out within the nation and Colorado, that the vaccines are extremely effective. However, the vaccine efficacy is slightly lower in cases when you compare it to the next slide, which is hospitalizations. So if you click to the next slide, Sarah. What we could see is the vaccines are extremely effective, which is exactly what we wanted in preventing those severe outcomes, both hospitalizations and deaths. But this goes back to my original point is no vaccine is 100% effective. And so we may, in addition to seeing some of our members of the community that are still unvaccinated, we may see some of those breakthrough cases in Broomfield. And this just further talks about the vaccine effectiveness, and it again is very effective against the Delta variant. Thankfully, we know that Delta variant is extremely transmissible, more transmissible than the other variants. But thankfully, the vaccine is very effective as far as preventing hospitalizations. We're seeing that with the Pfizer vaccine. They're seeing it play out with AstraZeneca, Moderna, they believe as well, since it's the same technology as the Pfizer, and J&J. They're seeing promising results from those studies. And then the next slide. As far as what that means for Broomfield is our incidence is in an elevated growth. As I mentioned before, we're seeing our cases slightly increase. We're now at 36.7 per 100,000. So we've moved out of that green and on the old dial framework to blue as far as our prevalence. And we're seeing that happen with quite a few of the counties in the Denver metro area. And our percent positivity has gone up to 3.6%. Again, we'll start to get worried if it approaches that 5% or increases above that, then we know that there's greater community transmission going on. Our incident rate is highest among the 20 to 39-year-olds. This is consistent with what we've seen the past 2 months, but also consistent with what we're seeing statewide. And then as far as the variants, these are cumulative cases that we've seen. And what you can see is we have one additional Delta variant that's been detected in Broomfield. And this just further goes into our breakthroughs that we're seeing. Again, this is a cumulative number. So over the period of time, and you think how many vaccines we've gave out in Broomfield, we have had 45 vaccine breakthrough cases. Thankfully, none of those have resulted in hospitalizations or deaths. We do expect, though, that this cumulative number will grow as more and more people become vaccinated and continue to be exposed to the virus. So that doesn't mean the proportion will change. It's just that we expect to see more breakthrough cases, so we have more of a vaccinated population versus when we started vaccinating people back in January, February, and March. And then the bottom line is still that vaccines are highly effective at preventing severe illness. And if you're unvaccinated, or again, if you're concerned at all about the potential for a breakthrough case, continue to follow those 4Ds, the mitigation measures that we've been putting out there since the beginning of the pandemic. And this just shows where those cases are happening in Broomfield. So as I mentioned before, we're seeing the majority of our cases in our 20 to 29-year-olds and 30 to 39-year-old age groups, which is a little bit surprising because when you think about those that are unvaccinated, you immediately think of the 0 to 9 age group. But we'll have to dig a little bit deeper into what this means. It could mean that we have greater mitigation and protection that's taking place with that 0 to 9 age group. And what we might see is more greater exposure and mobility happening with those other populations. The other thing we want to do, though, is track this as we enter into the fall in the school year starting, because we don't want to be at a point where we have both higher community transmission in those older age groups, and then we start to see that happen within our younger age groups as well. Next slide. So I'm going to turn it over to Deb to talk about where we're at as far as vaccines.
Sure, thanks, Jason. So we continue to track activity at the federal level and implications that has for us here in Colorado and in Broomfield. And so one of the things that we are tracking now, lots of discussion, will we be required to complete booster shots and for individuals that were vaccinated in the past year. And so at this time, the recommendation is still that for the general population, if you've been fully vaccinated, you do not yet need a booster shot. And at this point, we don't know if that will be necessary. So each month we get additional data, and we'll continue to monitor, but all of the studies showing to date that individuals that are fully vaccinated are maintaining high levels of immunity and protection, and a booster shot is not necessary. Now, there are some discussions about whether for specific populations, such as immunocompromised individuals, would there be some benefits? And that's actually a topic of discussion that the CDC's Advisory Committee on Immunization Practices, which is going to meet next week, that's one of the topics that they will be discussing. And so we'll continue to monitor and assess the situation, and certainly be ready to mobilize if we need to locally, but at this time, that is not yet on the horizon. The other thing that we often get questions about and are also following closely is, when we were meeting in the spring, we were discussing that clinical trials were underway for the children under the age of 12. As those trials continue and the vaccine move through the approval process, at one point we had indicated that fall was the target. At this time, it's looking like it might be more winter. And Helene is on the line and can speak more about what we're hearing, but I don't think we have much more specifics beyond that. But as we approach back to school time, I think it's becoming clear that we are not going to have the approvals for vaccinating the under 12 population just yet. So we'll continue to monitor that closely. So next slide, we'll just give you a picture of where we are. We continue to see our rates of individuals who have initiated or completed vaccination here in Broomfield County inching up every week. And we have actually now just crossed that 80% threshold for individuals that have initiated or completed the vaccination process in the 12 and older population here in Broomfield County. So at this point in the game, we aren't expecting to see huge jumps, but we are pleased to see that we continue to make progress. And that's really, at this stage, the result of targeted efforts that we will continue to engage in within key populations in our community, working closely with those trusted community partners like our vaccine ambassador organizations to make sure that everyone who is eligible has the opportunity to access the vaccine, have their questions answered, and the supports that they need to proceed if they would like to. One of the things that we also have been obviously doing a lot of research and looking into in terms of what is effective in moving individuals from thinking about receiving the vaccine to actually moving forward with becoming vaccinated. And there seems to be three main themes. One is just as more and more of the population becomes vaccinated and is many months out, and people see that their friends or family members or others that they know have successfully become vaccinated without any adverse effects, that builds their confidence in the vaccine. A second motivating factor is when individuals have the opportunity to really engage in conversations with trusted relationships, such as someone they know that works in the healthcare field, or a teacher, or someone, a friend or a family member whose opinion and information that they value. That can be very effective in having individuals feel like they're getting credible information that will help them make a decision. And then finally, I think as individuals consider what they may not be able to participate in, such as if colleges or universities are required vaccination for a return to campus this fall. Those are all other motivating factors for individuals to proceed with becoming vaccinated if they haven't yet. So we're continuing to look at those types of trends and figure out how we can continue to support our community with the information they need from the sources that they prefer to hear them from, and we'll continue to focus our efforts there. And then finally, just wanted to give you a snapshot of by age group, what our vaccination rates look like. As you can see, we are continuing to focus efforts in some of our younger population, including our 12 to 15-year-olds. With the start of school approaching, that continues to be a priority population in order to provide protections to our youth and families as they're returning to school. One thing we did want to note, we do update this data Monday through Friday, and we'll continue to do that, but we will be combining the 60 to 64 population and the 65 to 69 population to have it be in one group, 60 to 69-year-olds, just to align with the way that the case information is tracked, and so that we can do those comparisons. So I think that's all we had to share on the vaccination front, and I'll turn it back to you, Jason, to wrap up.
Yeah, so Broomfield, along with the Denver metro region, continues to follow a public health order. At this point, we're in level clear. We're not seeing the severity yet from the Delta variant, and thankfully the vaccines are working to take action. If we follow along the same trajectory, we feel like we'll be at a good place in August to let that order expire. Again, that's with the caveat that we don't see anything happen out of the ordinary with the variant that takes off in certain populations, or we see a significant increase in hospitalizations. The statewide public health order for face coverings remains in effect through August 1st. I mentioned this at the last council meeting. Primarily applies to those settings that are higher risk, so prisons, homeless shelters, and healthcare. You do see that schools are no longer required under the statewide public health order for face coverings. We are, however, awaiting the Colorado Department of Public Health and Environment to release their updated school guidance. We hope that it comes out this week, and that'll inform our recommendations that we're providing to schools for the upcoming fall semester. They're also going to be releasing updated guidance for higher education, for long-term care facilities when it comes to masking and testing, and other settings. So as we get that guidance, we'll be utilizing that as far as the messaging that we're going to be putting out locally to our partners. And with that, I believe it concludes our presentation. And I believe we only have Councilmember Lim. Oh, we have Councilmember Schaff on too. So we'd be happy to answer any questions, Councilmember Lim or Councilmember Schaff you may have.
I was curious about the emphasis that you put on having a vaccinated person who thinks they have been exposed get tested. So I had been reading nationally about that conversation, so I'm glad you emphasized that locally. Is there any discussion about, how to message that? I'm afraid that people who are already vaccinated are not going to be apt to go to the trouble to get tested just because is now that there isn't a prevalence of people getting tested, we have to go a lot further and to greater lengths to seek those tests. So.
Yeah, great question, Councilmember Lim. And Helene, do you want to sort of take that of the information you're sharing with partners, then we could talk about our broader communication efforts?
Sure, and thanks for having me. It's funny. I think you might have had a voice. You were listening into some meetings I was on earlier. That's exactly what we're trying to think about, is how to kind of message that, because I do, we have every confidence in the vaccine, and we know, as you just saw, we can see data that supports that. But with that said, they're not 100%, and so with that, we just do need to keep messaging. If it feels like it, you were exposed to COVID, if you have symptoms, that definitely still seeking out that testing. So we are trying to push that information out to our school partners, for example, with staff coming back, with students that have been eligible to get vaccinated, to be aware of, especially if they've had either exposure or symptoms. We've had of the small sprinkling that we've had in our county, we have heard some of the case investigations share with us. Maybe they didn't think to get testing until they lost sense of taste and smell. And so for some people, it doesn't hit them until then. And then it's like, so I do think it's something we're still trying to push out to our partners, to our businesses, and to our other, long-term care facilities. These are things that are in topics and meetings that we're on. So we are trying to push the information. But I think, in general, to the general public, I think that's where we're still, talking together as a team. What else would we like to message?
I wondered too, back to the CDC's current statement that now, we're not currently looking at the need for a booster. So if how much or what is the CDC using as a determinant for, is there a need for a booster? I know I was assuming, without any real professional knowledge, that if there were a huge number of breakthrough cases, then the CDC would start to look closer at, is there a need for a booster? And if nobody's getting tested, then nobody's going to know there's breakthrough cases. I was connecting things that way and wondering what your connection was there.
You really must be reading our minds, because we are having that conversation today as well. That's part of the Advisory Committee on Immunization Practices, the CDC and FDA, what they're reviewing as far as the data. So we know that the pharmaceutical companies have come out with some of their data saying that we believe there may be a need for booster shots. That being said, that's just one piece of data that the CDC will be looking at. So they're also going to be looking at, again, those complications that are occurring in which populations when they're looking at that severity and hospitalization. So you think about some of those first populations that we vaccinated, those older adults, those with other co-occurring issues, those that were in long-term care facilities. Additionally, what they'll be looking at is waning immunity, and part of that is looking at the overall vaccine effectiveness. So in addition to the clinical data and the trials that are going on and tracking those individuals that receive the vaccine, they're looking at epidemiology data and seeing, are we starting to see vaccine effectiveness go down, and what would be the contributing factors to that. And all of that data comprehensively, along with published data, is going to then lead to the recommendation of at what point do we need boosters, if we do, and secondly, for which populations. It may not be a recommendation for all populations. It may be for specific populations. And Helene, you're the expert, so whatever I missed, feel free to add or correct.
I think you touched on it well, and I think we meaning at the national level, they'll be continuously watching what pockets seem to have vaccine breakthroughs. Was it healthcare providers? Was it certain age groups? Everything kind of Jason just was sharing. And I'll just give a similarity, something else I'm working on that isn't COVID related, but is a similar type of realm of vaccine. The rabies preventative vaccine, there's a 3-dose pre-exposure series we give. And so the vaccine manufacturer and the guidance does not have a set revaccinations protocol, it depends on your risk. And so for someone like that's an animal service officer, an animal control officer, they have highest risk. And so they're most likely exposed to an unknown rabid animals versus a lot of times like a veterinarian or other things. They may not have, they usually know the known animal coming in, and as well as someone that's helping at a rescue or rehabilitation, lower risk, because again, they know the health of the animal. So that's not a 100% apples to apples comparison, but it kind of is an interesting comparison of maybe not everyone's going to be recommended the booster for COVID, or it may look different in terms of a timeline.
And then I have one more question. In our connections that we have with the 5 school districts, are they actively at this point in time trying to encourage the students, the younger students especially, to get vaccinated? Because it doesn't do much good, you know, if, no, I realize there's some that can't, but in that 12 up age group, to get vaccinated now, because their immunity won't be in full force in time for the school calendar year to start shortly.
Yeah, it's an excellent question, and Helene has the most direct contact with our 2 school districts and the operations teams that are working on this. I would say at the superintendent level, most superintendents are waiting to see what guidance comes out from the state health department before making their final recommendations. But everything I've heard from superintendents is there will continue to be a push from them as well for students and those staff to get vaccinated that are unvaccinated, and if they're eligible to get vaccinated. Helene, I don't know if you have anything to add.
Yeah, and I would just, in general, across the board, all the school districts that we have, we definitely meet the most with Adams 12 and BVSD, but we do touch with all of them, and we do same with our private schools, same with our charter schools, our childcare centers. And so a couple things we are definitely trying to promote. If you need a vaccine clinic at an upcoming event, and then some are, you know, we talked about with, for example, staff that have maybe been remote this whole past year. Does anyone need access? Would you like us to come on site to do a vaccine clinic? So we are putting that out there, as well as just making sure everybody knows of some of the apps and things that are out there to like easily find who has what, because at this point in the game, some people are more like, I only want Moderna, or I only want Pfizer. So just trying to make sure that all of the tools that are out there that they're aware of. So we are sharing that. I know that some of the schools districts, some of the schools have done smaller subclinics at some of their sites. In particular, I know Adams 12 has had a few different things going on recently. So definitely the message is still being pushed.
Okay, thank you.
Thanks, Councilmember Lim. Councilmember Schaaf, I see you're on mute and off video, so I'll give you a couple or a few seconds to see if you have any questions. If not, we can move on.
No, Jason, I don't have any additional questions. Thank you.
Thanks, Councilmember Schaaf. Well, again, we appreciate your time today. Councilmember Lim, as always, very insightful questions that I think will help the other council members as they're watching this recording. And we'll continue to monitor the situation closely, what's happening nationally and how it impacts Colorado. And as we get additional information that may warrant more immediate updates, we'll make sure we get that out to council. So with that, thanks again for your time, and we'll see you during our next regular council update. Thanks.
Thank you, everyone.